Good morning, everyone, and thank you NNI and SGH for inviting PSS to be at the public forum once again. My name is Choon Ling, and I'm the Centre Manager from Parkinsons Society Singapore. Now, before we go into what PSS has to offer in support of Parkinson patients and their caregivers, I'd like to share that one of the key takeaways today that should be the importance of staying active on the Parkinson journey, as supported by many research studies. Regular exercise helps to delay the progression of Parkinson's symptoms, and what is also important is to start establishing exercise habits as early as when the patient is first diagnosed, so that it slows down the stage 3, 4, and 5 from coming on too soon. And this is where Parkinson's Society tries to come in and help everyone. Now, a quick background on PSS. We were started about 25 years ago by a group of doctors and caregivers, and Singapore's first community-based Parkinson Centre outside the hospitals to provide care and support for Parkinson patients opened in Bishan in 2013. Now, PSS is a registered charity with the National Council of Social Science, and we are a relatively small team of 7 full-time staff, supported by a team of dedicated board members, volunteers, therapists, and instructors for our respective programs. Apart from providing therapeutic programs and services to help patients stay active, maintain their functions and total well-being, we also hope to promote awareness and understanding for Parkinson amongst the general public, as well as to establish a social and community network of support for patients and caregivers through our support groups, healthcare training, and social events. Although everyone's journey may be different, we would like each patient and caregiver to know that you are not alone. PSS and many of our Parkinson warriors and families are here for you. Now, a quick glance at what we have to offer at PSS. Under the therapeutic programs, we have 4 major categories, namely the movement training, voice training, dexterity training, which helps improve your hand functions, and cognitive stimulation. We'll go into some of this later. Next, we also work with community partners for social recreational activities to promote overall well-being as well as promoting awareness through outreach programs. Another key partnership is with St. Luke's Elder Care, which we will share with you shortly. We also work closely with the respective healthcare partners on public education, such as today's public forum, as well as provide platforms for sharing by both patients and caregivers through the various support groups. Now, to highlight some of our programs and services where Parkinson patients and caregivers can look forward to. Our core program at PSS is physiotherapy, where patients come for once a week hourly sessions to exercise under the care of our experienced physiotherapists. You might have seen how our small group classes are run in the video during the break just now. I personally think it's so much more impactful and fun to exercise in a small group setting because I know it's really tough to be motivated to exercise alone or at home. To join this class, you will need a referral letter from the doctor and go through an initial one-to-one assessment by our physiotherapist to put you in the right class. One of our most popular classes is adapted kickboxing. Yes, many of our members took this up when we first introduced the program in 2017, and many of them have stayed on. So we have had to open up more classes in recent years and keep a waiting list. We will do an assessment before admitting you to the program so that we know you're suitable and it's safe for you to do adapted kickboxing. We also have both sitting and standing Tai Chi for patients at the various stages of Parkinson. Now, under the vocal training, we have speech therapy classes, which are currently conducted online since COVID started. We cannot overemphasize the need to also proactively work our vocal muscles because, like our body muscles, we can also lose vocal muscles if we don't use them. This will not just lead to weakened speech capability, but also affect swallowing. So please, at regular intervals, consult a speech therapist. And to join our ST classes, you will also need a referral letter from your doctor. Now, singing is also another way of keeping your vocal muscles active. We're happy to have introduced a new class this year for members who are more inclined to singing in English, while our Do Re Mi continues to be conducted for our Mandarin-speaking members. But singing is free, and we encourage all of you to sing daily at home as part of your vocal training exercise. These classes are currently conducted online, but I think with the relaxed rules, we may be able to bring some of the vocal classes or speech therapy classes back at our center. Next, we have been very privileged to have Dr. Tan Seok Bee from SGH to volunteer and conduct the EFT Tapping Workshops on a monthly basis. This session is suitable for both patients and caregivers. Now, the EFT tapping technique has been scientifically proven to help relieve chronic pain and stress. And members who have practiced, come through these workshops and practice at home after the workshop each month, they have shared with us that it has helped them a lot. So do sign up for EFT tapping workshops if you have not. We have also been very blessed to have Sister Li Wei from NNI helping to facilitate our bi-monthly caregivers workshops. Now, this was a quarterly event in the past years, but due to the demand and we feel the need for caregivers to look after themselves, we have turned it into a bi-monthly session this year. So this session is exclusively for caregivers, as we would also like to provide them with an avenue to air their challenges freely and share tips on caregiving, as it can be as daunting and stressful to take care of Parkinson patients as it is as tough a journey for the patient themselves. So once in 2 months, caregivers, please make time to join us and practice some self-care. Youthful Parkinson Circle. This is a support group which meets once in 2 months as well, bi-monthly. And we are thankful to Sister Usani from SGH for facilitating this session. This is also open to both patients and caregivers. So each session currently conducted online is also facilitated by a trained professional. If it's not Sister Usani, it's someone else from SGH, but they will always cover a topic that's of interest to those who were diagnosed before the age of 60, followed by a sharing session. Now, we just started a new series of 10 workshops this year called the Parkinson Network, or PNET in short. This is like an orientation for newly diagnosed patients and those who are still within their first 5 years of diagnosis. It covers a wide spectrum of topics, and there will be a small group discussion after each presentation. So this is also open to both patients and caregivers. Now we'll just quickly show you the other activities which we organize at PSS at a glance. So we have social recreational activities covering from different spectrum of interests. We realized that many of our members like to sing, and we also did a farming or planting online workshop conducted by one of the schools we work with. Each year, we also try to have a full-day workshop. Unfortunately, for the Empowering Parkinson in Action boot camps, we have suspended for the past 2 years. We're hoping to bring it back in some form this year, okay? And of course, we are very grateful that we're invited to all the public forums every year. Community partnership, we work with different schools, organizations, and companies, and we are really grateful for their help. It's quite interesting to see how the intergeneration, especially the interaction amongst the members and the younger generation. Now, due to COVID, we've not had our annual Move to Beat Parkinson community outreach event. For the sharp-eye audience amongst you, you probably can see our last event in 2019 in the photo, where the guest of honor was then Health Minister, Mr. Gan Kim Yong. We hope we can resume this event next year in April again, coinciding with the World Parkinson's Day. But in the meantime, you can support our virtual charity run. This will be our 2nd year organizing this virtually. So look out for details on our Facebook and website, because this year we've added the element of cycling. Okay, so we look forward to your participation and support. For patients who live far from Bishan, we're happy to share that our partner, St. Luke's Elder Care, is offering Parkinson group exercises too. at more than 20 of their centers island-wide under our community training program. So if you take a look at other day rehab centers or community hospitals, most of their physiotherapy classes are meant for dementia and stroke patients, because those numbers are sheer bigger than Parkinson patients. So if you want a dedicated Parkinson group exercise, physiotherapy exercise, please come to Bishan or pick a St. Luke's Elder Care Center that's near your home. We are also an independent charity and need to fundraise to support our operating expenses. So do support our campaigns, okay? We also have very good resources through the books, and as you can see, the Moving Towards a Brighter Tomorrow. It gives you a spectrum of the A to Z of what to expect when you are diagnosed with Parkinson. And there's also videos on our website. And if you're visiting your physiotherapists at the hospitals, you can ask for a copy of the Parkinson exercise booklet too. Now call us if you need access to these materials, and we can also connect with your physiotherapists at the hospitals. Well, like I mentioned at the start, the key takeaways today is not just about coming to PSS for our programs and activities, but knowing these three number ones, okay? We would like to remind you to stay positive, stay active, and also don't walk alone on the Parkinson journey. Reach out to us, come and get to know more Parkinson patients and more Parkinson warriors, and stay engaged. It has helped many others, and we believe it would really help you and your loved ones too. We would also like to remind you that even if you come for our classes once a week, right, it's never enough. We cannot overemphasize the need for you to do different exercises and different activities in all these categories. This has a lot more impact than the weekly classes that you come for at PSS or anywhere else. So really, please establish a daily routine as soon as possible. Now, here are some examples of Parkinson warriors who continue to stay positive, active, and engaged. Now, several of them, you may be surprised, have been diagnosed with more than 8, 10, and even 22 years ago. So if they can walk the marathon, they can climb the mountains, you know, you really, really need to believe in the power of staying positive and staying active. Okay. Now, this is how you can reach us, our contact details. We are open Mondays to Fridays, 8 a.m. to 5 p.m., closed on the weekends and public holidays. You can stay updated on our Facebook and on our website for all the programs and activities. Now, thank you for your time, and we wish you a blessed weekend.